They're trained to take care of us. The job of a doctor, nurse, any caretaker can be stressful on its own. The COVID-19 pandemic adding new stress and highlighting a serious issue that will linger even when this is all over.
Emotionally, it's kind of humbled us to give a different type of care. You're being everything for them at once.
Different studies show the pandemic could have a lasting emotional toll on those on the front lines. The CDC comparing some of those symptoms to PTSD. I asked Alexandria and Joanna, nurses at Integris Baptist, if they agreed.
So there'll definitely be PTSD, 100%.
I've gone so far as to say this last 5 months in my nursing career has been probably the biggest emotional toll.
All of these patients in this ICU are COVID positive.
As we're still not allowed inside hospitals, Integris Health sharing this video with us, taking us inside an ICU with COVID patients.
This is one of our more seriously ill patients on a bed to help them rotate, move their lungs around so that they can try and breathe better.
The pandemic is affecting everyone worldwide with hundreds of thousands of deaths. But our caretakers don't just see the data. They're sitting bedside, watching as patients take their last breath.
There's multiple times that the nurses, RTs, and the physicians, we are the only ones holding their hands, and along with chaplains as well. Whenever they pass.
It's been 6 months since we first felt the impact of the virus here in Oklahoma. Since then, thousands have tested positive and hundreds have lost their lives. Some progress is being made, but the fight is far from over.
At first, I spent a lot of time crying, I'm not going to lie. I've had my own panic attacks early on. I've had my own crying jags early on. If I didn't, I wouldn't be human, I don't think.
Dr. Rachel Franklin holds many titles, among them operating the respiratory clinic for OU physicians, working labor and delivery, and she's the medical director for OU Physicians Family Medicine. This video provided by OU Med.
What kind of emotional impact has this had maybe on you or some of your colleagues?
You know, it's been a roller coaster, and the first thing that I can say is that we recognize as healthcare workers that every single human is in this together.
Dr. Franklin says since the pandemic, healthcare workers have seen more cases of depression and anxiety amongst each other and patients. She says there's a lot being done to help, but it's still a difficult time for all levels of caregiving.
If you love people, you will suffer when they hurt.
Most companies that insure healthcare workers have an employee assistance program that provides free counseling. Hospitals also have behavioral health specialists on hand and offer peer-to-peer counseling.
I go through counseling. I've increased those appointments just to make sure that I decompress.
On top of what they're seeing at work, there's also fear of taking the virus home and spreading it to loved ones.
I have a decontamination process that I go through.
Dr. Franklin, Alexandria, and Joanna sharing similar routines, undressing in the garage, tossing work clothes in the laundry, and showering immediately. All extra precautions to keep their families at home safe.
It's not something to be taken lightly.
Even as we get closer to some type of relief with less cases and deaths, it's essential our caretakers are taken care of.
And if we just approach each other with some grace, then we'll provide space to allow each other to heal and to find some, for lack of a better word, new normal.
And remember that this too shall pass. Alejandra Briones, KOCO 5 News.